It'll be a week tomorrow that former President Joe Biden was diagnosed with late-stage prostate cancer that doctors labeled as aggressive. They also said the cancer had spread to the ex-president's bones. Joining us now here on First at 4 to help us understand more about prostate cancer is Dr. Ryan Chartrand. He's from the Urological Services of Flint. And Dr. Chartrand, thank you so much for joining us here on First at 4.
Well, thanks for having me.
Let's just start, I think the question that everyone has on their mind. Explain what late-stage prostate cancer is.
Yeah, so late-stage prostate cancer is prostate cancer that's defined as either locally advanced or has distant metastases. So locally advanced prostate cancer is prostate cancer that has spread to the surrounding tissues, like the fat around the prostate, the seminal vesicles, which are glands around the prostate, or even to the rectum. And distant metastases means that it's spread to the lymph nodes, possibly the bone, or distant organs like the liver or the colon.
And the former president, he is over the age of 80, and we know the PSA test is usually what is used to diagnose prostate cancer in men. Is that correct?
It is.
There's a little, I don't want to call it controversy, but some doctors say that after 70, it really doesn't do any good for men to get that test. Is that the general thinking, or?
Well, that recommendation came from the U.S. Preventative Task Force, which I don't agree with. I don't know that there was any urologists on that panel. I currently recommend that if you have a higher chance of getting prostate cancer, if you are an African American, or if you have a family history, the American Urologic Association recommends that you should get your PSA checked at around the age of 45 to 54, and then every year after that. When you do get to a certain age, say you get into your 80s, that's a discussion you can have with your doctor. Talk to them. If you found prostate cancer, would you even treat it? And if they're not willing to treat the prostate cancer, we don't need to check that anymore.
Okay, and you know, they've reported, we don't know the ex-president's doctors, but they've reported that he was experiencing some urinary symptoms, and that's how this was found. What kind of symptoms are associated with this type of cancer that would be cause for concern?
Sure. So some of the concerning symptoms that you can have would be unexpected weight loss or fatigue. You can also get bone pain, like in your lower back, your hips, pelvis. You can also get blood in the semen, blood in the urine. Some of the urinary symptoms would include burning when you urinate, urgency, frequency. Now, I don't want to scare people. Just because you have one of those symptoms doesn't mean you have prostate cancer. But if you have a combination of those symptoms, you should talk to your primary care doctor or see a urologist.
Yeah. And what treatments would you say are available? You said sometimes men over the age of 80 don't want to get treatment for prostate cancer, but what treatments are available, and are the treatments different for, let's say, is it hormone-fed cancer? Is that what it's called?
Yeah, hormone sensitive. Yeah, I believe they use the term hormone sensitive, which is a term we use as urologists. So based on the staging really determines our treatment. So if your prostate cancer is localized to the prostate, then the bread and butter of prostate cancer treatment becomes robotic radical prostatectomy, or remove the prostate robotically, or external therapy, or external beam therapy, which is radiation. If it has spread, then we start to use terms like hormone sensitive or hormone insensitive, where we use a medication, it's termed ADT, androgen deprivation therapy. It's where we take away your testosterone. And the reason we do that is because prostate cancer uses testosterone to grow. So if we take away its food source, it's less likely to progress.
Right, right. And let's talk about this. Is it a Gleason test?
Yeah.
Okay, the Gleason test. Explain that for us.
Sure. So a Gleason test is something that we do after we get a prostate biopsy. Say you have an abnormal PSA or lab value, an abnormal rectal exam. We will look at that prostate biopsy under a microscope, and then we will determine the score. And the score is from 6 to 10. If you have a score of 8, 9, or 10, that is a higher grade or higher risk prostate cancer, more likely to spread and be life-threatening.
And men who are watching, or the wives who are watching, where can men go to get treatment, or go to get a test, a PSA test, or go to get more information about their prostate health?
I would always recommend that you start with your primary care doctor. After that, there are websites that you can use, whether it be the National Cancer Institute, the American Urologic Association, Mayo Clinic, University of Michigan. I've used these websites. They all have great information about PSA screening, recommendations, when to talk to your doctor.
Thank you so much, Dr. Chartrand. This is potentially life-saving information for someone. And thanks for coming in and sharing it with us today.
You're welcome.